Welcome to the Biomesight podcast, hosted by Dr. Carly Polland, clinical lead at Biomesight. Biomesight is an AI-driven wellness analytics platform with a primary focus on the gut microbiome as a leading indicator of wellness. Biomesight practitioners and medical experts join us to discuss the microbiome and 16S rRNA sequencing as it relates to health. This podcast is intended for practitioners and patients alike. We are spreading knowledge and sharing resources so we can improve our microbiomes and health using the latest technology. Head on over to biomesight.com to purchase your stool test kit to discover your microbiome. Practitioners can register for a free account to get access to our gut microbiome analysis platform that supports FastQ uploads from multiple labs. Please note this podcast series is not intended to diagnose or treat medical conditions. Ask your doctor before initiating any new treatments. Ahmed Dewedar is a clinical pharmacist and functional medicine practitioner with a deep understanding of pharmacology and the interplay between the immune system, gut health, and nutrition. With 2 master's degrees in biotechnology and experimental medicine, our guest has a unique perspective on autism and a toolbox of professional capabilities to help families dealing with this multifactorial condition. As a father of an autistic child himself, Ahmed understands the challenges that families face and is passionate about helping his clients achieve success in treating autism. With a commitment to evidence-based medicine and complementary therapies, he works closely with his clients to identify the root causes of their child's condition and develop personalized treatment plans. Let's start with you telling us more about the work you do with the microbiome with people with autism.
Yeah, good question. So, basically, the first thing I will just order a 16S test to look and see how the microbiome look like. I came kind of a little late, which is a positive thing. But I didn't use a lot of the other old tests, actually, kind of the comprehensive stool analysis or these culture methods. So it was kind of the first thing I was more introduced to was, the 16S. So that was actually a positive thing for me to come late. So that's actually the first thing that I will do. Sometimes I will have to do some kind of empirical approaches if especially when I'm dealing with places where it's very hard to test or will take for a long time. I have this kind of issues that a turnaround for a test is kind of 4-6 months is.
Wow.
That's a lot. Yeah, that's a lot. I know. And then you have to do some empirical stuff before you get the results. And this will include to map what is the problem with the microbiome. And here I will include the fungi as well, because it's a part of the microbiome, even if we don't talk like too much about the fungi, but it's actually a major player when it comes to autism. So I will check for some kind of clinical picture for what's a candida in particular, as we call it, like AKA candida, like or yeast. And then if I can do an empirical approach for that until I'm waiting for the whole picture, and then I will start from there. I will take it from there. What's there, what's out, and yes, what's normal and normal between quotations, and start from there.
Okay, so lots of follow-up questions there. So first, what led you to this work? Why did you become interested in autism?
It's not a new story. It's an old news story. So my son got autism. So when he was as like 1 year old, I start to feel something. That's like always what you hear from autistic like parents, that you feel there is something in the gut that tells you. that there is something not okay. And then you just wait. Maybe he's kind of a little bit late for this development. But by the age of like kind of 2.5, that was clear for me that he has autism. Then I started to, back then, actually, all what I knew about autism is just like this very little that I studied in the college.
Mhm.
I'm graduated from pharmacy college in Egypt back then. So, and then we had just very little about autism. That's being lonely, and there is no cure. And of course, autism is kind of, yeah, the smart guy or the very genius guys there out there, Einstein and all these myths that you hear.
Mhm.
Yeah, so I started to become very interested in helping my son here. Very simple. Start to read about the research, what's there in the research, and um, yes, and all the biomedical kind of stuff opened for me. So I was on the other side as well,
Mhm.
kind of the thinking traditionally and classically about autism and nothing to do with except for the PE and the training or that stuff. Um, until actually I believe that autism can be, um, or at least autism is a kind of an disease that can be reversed. Um, yes, to this kind of like the other side,
Mhm.
as I call it.
So do you find that you're mostly working on the microbiome, or are there other aspects of physiology that you, address with autism as well?
Well, I look holistically. I look for the whole body, and microbiome is kind of a very keystone in this whole picture. So it's not only microbiome. Actually, I I respect microbiome as the second most important thing in the autism
Okay.
kind of whole picture. The first thing for me, as my understanding, is the oxidative stress, and that's intertwined with the mitochondrial dysfunctions. I find this actually the very big motor for autism. Hard to distinguish and say now, but like the microbiome is a way. It's not that I'm saying, but the very big motor in the picture here is the oxidative stress by the environmental toxins um, during the pregnancy or after the pregnancy, if it's classical autism or regressive autism, but still the oxidative stress is kind of the main elephant here in the room. And then you have, of course, the microbiome. So that's kind of the very big approach that I'm dealing with as well. Because yeah, they definitely there is a um, very clear link between the microbiome and autism. It's almost kind of causative as well,
Mhm.
not just. And I'm talking about the core autistic features as well, not just like the problem with this gut disturbances
Yeah.
or maybe diarrhea or constipation or something that we hear. I'm talking about repetitive movement or OCDs or yeah, these autistic traits that we can relate to or deal with.
Okay. Alright, so you mentioned that you feel like the yeast component of the microbiome is important in autism. What other patterns with the bacteria, what are you seeing in the 16S data, that are patterns or trends in the autism community that you address?
Yes, uh, it's very hard to see just one pattern. There is
Mhm.
patterns in there. I would say the very one pattern is the dysbiosis. How you say? Although there is some kind of autistic children that don't have any dysbiosis actually, and they have very lovely 16S, just as you would like to have actually. But
Mhm.
this is very minority there. But the majority that you feel no, this there is no balance here. The gut is out of order here, and then you have under this different patterns. Um, one of the main patterns that I can see a lot is actually diminished lactobacilli and
Hmm.
bifido in the second place. But like, I wouldn't exaggerate if I say 95% is doesn't have any lactobacillus at all.
Wow.
If
Okay.
you say that's kind of for my patients as well, or the cohort that I'm seeing, and I tend to correlate this with fungi. Actually, I tend to think if there is a very big issues in the candida, there is highly probably because of the lactobacilli is diminished or extinct from the gut, almost there. Um, and it does make sense if you think about the lactobacilli, the dominant species or bacteria in the vaginal canal, for example.
Hmm.
And if it's disbalanced, then you have candidosis there or candida overgrowth there. And then you have to supplement with lactobacillus actually to get rid of the candida there. So it does make sense. And the interplay between the lactobacillus and fungi is kind of well established in the research, actually.
Yeah.
They compete for the same place. They compete for this kind of metabolites. If you think about the tryptophan, for example, the metabolites there, they compete for the same metabolites and the same place. And they
Okay.
have a lot of interplay as well. And a bifid, of course, there is diminished bifidobacterium there. And in the third place is the hydrogen sulfide producer.
Hmm.
I have to see someone with autism or maybe brain fog or any other problem if he is adult, not with autism, because sometimes I see this client as well. I have to see one without structural overgrowth.
Yeah.
That's a hallmark. Like, okay, I know that. I have to treat this before I see anything. This kind of hydrogen sulfide producer is almost in everyone that I have came across.
Hmm.
And then, of course, you have like maybe 50-50 with the butyrate. So some will have diminished butyrate there with the Faecalibacterium prasinitzi, kind of the main that you look for, but other Clostridia as well,
Hmm.
or butyric producers. But I would say that's not a very accurate statistics, but I would say 50-50, maybe more than 54 like less producer. And the propionic axis as well, that's kind of the Bacteroides
Hmm.
kind of stuff that you have. The majority is kind of Bacteroides overgrowth. They will have the Bacteroides. Very little that they will have the other, which is the Provotella overgrowth, and it would be mainly the copri,
Hmm.
the Provotella copri. And this is very clear. They will have 70, 60, 80% of their gut just Provotella copri. Kind of weird thing with
Yeah.
this cohort. Of course, the LPS, that's very clear. And it's also pronounced because most of these cohort, because of the very big oxidative stress I was referring to as a big motor, is actually impacting the lining of the gut and causing leaky guts. And this become very big problem there because it's very easy to have the LPS cross to
Yeah.
the other side and block they got the tight junctions if there is a leak gut, so will easily pass to the bloodstream and causing more inflammation and more oxidative stress
Hmm.
by itself.
Yeah. With the LPS producers, with the proteobacteria, what kind of relative abundance are you seeing?
Proteobacteria, so I have seen, for example, 20% proteobacteria.
Wow. Okay. Yeah.
That was kind of yes. And as a side note, as I had a case that I had a proteobacteria at 6, and I was like kind of freaking. No, we should get this at 3 or something like that.
Hmm.
Um, and with the follow up, I got 20%. So I was like, no, there's no way. I have kind of 100% success with that. What happened? I was talking. What happened there? What did you get this right? Did you take that right? My recommendation. And at the end of the consultation, I got, yeah, but we took the test 2 weeks after she took an antibiotic course. She got
Oh,
sick, and we had to give an antibiotic. Thank you. I was questioning myself.
yeah.
And yeah, so I've seen as well 20% after an antibiotic, like kind of course, and that's kind of yeah, I see it in real life, not just like reading in the research here about
Yeah.
the proteobacteria, and of course all the worsening of symptoms that you can see
Mhm.
from kind of the inflammation that the LPS will
Mhm.
do. But the Sotorella is a main part
Yeah.
in a proteobacteria. Of course, you get some of the biophilia as well. So the stubborn one
Mhm.
that you'll get, but others proteobacteria, the E. coli, you will find them as well. Shigella, if you test for mm,
Mhm.
for other labs then. Um, but these kind of proteobacteria that I see. And I should say, apart from the biophilia, it's not that hard to treat
Mhm.
the proteobacteria. It's I find it very easy to treat actually the proteobacteria if we are somehow strict with the protocols. You can knock it out with one round.
Mhm. Yeah, that's been my experience too. What modalities do you like to use for the proteobacteria? Are you doing prebiotics, probiotics, herbs? What do you find to be the most helpful there?
I think I have a very good success with the lactitol and lactulose
Okay.
as a
Prebiotics,
solo.
cool.
That's for like the whole proteobacteria, and then depending on which one, then I will add something more. Depending on which one they are, if it's probiotic or prebiotics. But for example, the Sotrella or the disulfivibro, for example, if it's a high disulfivibro, then I will go for Cotinopsis directly, and I know it will do the job. For example, um, yeah. um, sometimes I will use if there is a high E. coli, for example, then maybe I will use the uh, mm, what's called the mutaphor, for example, the E. coli Neisseria
Okay, yeah.
1817 or 19, the
Mhm.
Mutafor, the one comes from Germany. It's a very good success. I will overlap as well with the Clostridia difficile or any kind of bad Clostridia that's there. I will use that. But yeah, these two prebiotics in my main arsenal against the proteobacteria as a whole, and then I had to throw in some else depending on which kind of
Mhm.
for biophilia, I has to add maybe more prebiotics and be very strict with the diary.
Mhm.
But it is a kind of stubborn bacteria if you have it in a bacteria.
Yeah, that's been my experience as well. So it's quite stubborn. So I'm wanting to talk about your theories on why the microbiome is so important, not just for the digestive symptoms that you're seeing in autism, but also for the neurological symptoms, for a lack of a better term there. So you mentioned, like LPS, leaky gut, that contributing to oxidative stress. But what other theories do you have about the role the microbiome is playing?
Well, maybe not my theory, but kind of a theory in the literature that I'm reading about is it's this kind of the window of opportunity that you have when you're kind of little baby. There, you have, and I tend to look at in this way. You have an immature your like nervous system, of course, you're developing as a little baby, and you have an immature immune system, and they both have to be trained. If we take the immune system now, the immune system have to be trained, have to know what's there out there, right? So, and how should I react to this stuff? So, the first thing is that you need to be introduced to these kind of different antigens, if you would say, and under this window of opportunities, then the immune system is tuned not to react that bad or that hard. And so if you introduce to this antigen, then, or maybe as like antigen from the bacteria itself, because we know now that the normal microbiome passing to the bloodstream, actually. So it's not
Mhm.
just the bad guys. Everything is passing to the other side and being sampled 24 hours by the dendritic cells there. Um, but during this period of opportunity, the system will say, okay, now we know what's there. I don't have to kind of react or overreact if I see this again. And this may be why now we have. I'm sure it will be out in the market soon. It's kind of a dust. There will be a drug to prevent allergy.
Mm-hmm.
So it will be yeah. You sell the Folka dust to give to their babies so they don't develop allergies. And it's coming from the cow thing or like farms or something like that. So exposing our microbiome to these kind of antigens, and then they will train the immune system that here it is, this kind of normal environment there, or maybe no, this kind of bad bacteria, it's not normal kind because you still have to fight that. So this is very fascinating and frightening as well. There's
Mm-hmm.
this kind of a very short window of opportunity that if you miss it, then you have to work hard to correct that afterward. And we see that from the very rise in allergies
Yeah.
and the hygiene hypothesis. But as well, I tend to see the neurons and neurodevelopment as well. This conjuncture between the change in diversity, the different kind of bacteria there, and the milestones that we see in the brain development, where the sensory start to develop, for example. And you have a lot of neurons that this, and we see that at this point, and especially, for example, around 6 months, the introduction of a solid food, then we see a very boom in a diversity of them. And then at 2 years mark, and we see another boom in the microbiome diversity and different bacteria, but we see as well a boom in a neurodiversity. So they are kind of superimposed with each other. And I tend to think that if we don't have the right bacteria there in the right time, then there is no right signals that will signal for the brain that it's time now to move on to the next step.
Mm-hmm.
Because of course there is a talk up there to the brain and from the brain to the whole system. So if, for example, you fail to crawl or you fail to go at this certain or like the milestones, then we know that this will reflect to the brain that you are not fully developed, and the brain will slow down in the development, and you get in this loop. Um, it I think it's the same in the gut as well. So sending these signals to the brain in the developmental like stages. So if you are a C-section, a baby with C-section missing all these kind of keystones bacteria, then your immune system is not going to be trained right, and your like nervous system is not going to take these signals and know to orient right to the like outside environment. And then of course from there, from after the development, you will find the gut brain axis and the effect of the metabolites and
Mm-hmm.
then the inflammation and the LPS to send on LPS. And when we know if you have an inflammation, the brain is not going to develop right. And if body inflammation, you have a brain inflammation at the end of the day. And if you have a brain inflammation, then a microglia is not going to function as it should as a cell that will support for the nervous system and providing for the nutrients and guiding the synaptic pronings. It will just turn to a macrophage or an immune cell and forget about its role until then the inflammation is dampened down. And this is this kind of like a conjuncture that I'm working on a lot uh, in to see the whole picture there for which from where the inflammation is coming from. If I can't control the inflammation in the gut microbiome, then I'm 100% sure that the brain is being in fire 24-hour if I can prevent this. And I'm not going to go further in like having some success with the clients if I can dampen this kind of continuous inflammation. It's not just like one-time inflammation, it's 24-hour because we have the
Hmm.
gut microbiome working the whole time.
All right. Well, that definitely makes a whole lot of sense there. Um, okay. So last thing I want to talk about is fecal transplants. So what are
Yeah.
your thoughts on that?
Yeah. So I'm very positive to any interventions that will decrease or alleviate the suffering that our kids suffer from. Even if it's like on the edge of the science,
Mhm.
it's not kind of very well understood, a black box as the FMT, or it's not kind of an FDA approved for treating autism, or it's now just approved for the clostridial difficile. Uh, but I'm very positive to use anything that will help our kids. We can't wait uh, too much for helping them, because if we wait, we are going to miss a lot in the way. With that said, I myself uh, uh, will actually be 100% sure that there is no any other options um, that can be used to modulate the gut dysbiosis other than the FMT.
Mhm.
Um, I tend to see the microbiome as an organ. And if you do an organ transplant, then you need to have a match. And if you do an organ transplant, you have to anticipate that actually, if you do a heart transplant, you have to anticipate that this new guy will love something that he will never love before,
Mhm.
or start to play piano as the very famous example, although he didn't play piano for the 60 years before that. So there is something that you get as well, that you can see. So if you can take some good guy and you find this super donor, everyone is running to find the good match. And still we don't know how to find them exactly,
Yeah.
just like stamped by them. We It's very, very black box. And it's coming from, we can define normal or normal in this field. But this also as well, something that you have to weigh on, that you are going to get something, you don't know what it is,
Mhm.
and we don't know what it is now. In So it's kind of you have to fit this in your safety or weighing benefit to risk ratios, that you are going to maybe get benefits if you find a super donor, the matched one, but maybe this guy will develop Parkinson in the future.
Mhm.
And this microbiome is going to push for this forward. You don't know, and I don't know. Uh, if there is no any other options, then you may consider this one. But I tend to see that this is very rare
Yeah, I would
cases.
think so too.
Uh,
Yeah.
I had a case that I said I can't see any light for us except as an FMT. It was very bad shape, very low diversity. I very, very low diversity in there, and bacteria that's taking 80% of the gut with very low diversity. Everything is out of order. So it's very hard to work with that. How can you inoculate that much if you have below one as a Shannon index for the diversity?
Wow. Okay. Yeah.
Yeah, that's kind, and you can't find any inoculation except for FMT or something. And then they can do the FMT, and I said, okay, we can do an FMT, but we can try our best. So I couldn't see any other options, but we say we can do the option, then we don't have anything to lose to try. And we tried with kind of a intensive 6 months course. Keep in mind that this was actually one case that there is 6 months turnaround for a test.
Okay.
They can't get a test kit inside the country. They have to buy it through some vendors. They will send there. It's very very complicated. And so we decided to work with what we have and give it a try, maybe, and boom, uh, more than toppling in the diversity. I think we ended up like in an edge for the Shannon index, the 25 percentile. Yeah, and it's like the 50% there. And like the bacteria that was 60-70% is now 20%. They're nice there. I got all, like, kind of almost all the bacteria that I want there flourishing there. And I couldn't believe myself, to be honest.
Yeah.
Um, so then I came to say, okay, maybe it's kind of, this is kind of much more safer than FMT, of course. It's not kind of very fast as an FMT, if you want. Different protocols, of course, there is for FMT. But at least you wouldn't expect to get something that you don't know is an FMT right now, or what will happen. But give it a try first. We'll see if we can modulate the gut microbiome. And it's actually, as my experience now, I've been working with the microbiome for more than 2 years now, with the 16S, and doing it maybe 3 years. It's very malleable,
Yeah.
very, very malleable. And you get almost what you want if you search right in the literature about what should do this and that. Of course, it's a very big difference between like this and clinical picture. We didn't talk about what's maybe the gains that you will find when you modulate the gut and you make it like balanced.
Mhm.
Um, but at least it's very malleable. At least you can manipulate the gut to a state where you think it's kind of eubiosis, not a dysbiotic gut.
Mhm. Yeah, definitely. I feel like a lot of practitioners who may not be using the 16S sequencing, they're kind of stuck in the old paradigm of, if I want to manipulate the microbiome, I just give this very standard generic probiotic. So they might not be getting the result or seeing the benefits and think that, oh, okay, well, if I can't use a probiotic and it's not working, then let's do a fecal transplant. But yeah, when you use the 16S data and you see everything that's going on and you go to the research and you see we have so many different tools to modulate the microbiome. And yeah, in my experience, um, there's so much we can do and get great results. So with the autism community, in terms of like symptom improvements, what are you seeing after you modulate the microbiome?
Yes. Uh, I would expect any improvement actually across all the symptoms in autism. Um, and basically, if you see like a lot of improvement that will cover different things, you think about, okay, that's the inflammation part's coming part, because if you fix this and lower the inflammation, then you start to heal. What's the problem there? So it's not much more related to a specific kind of bacterium.
Mhm.
But I see as well a very good trend when I control the hydrogen sulfide axis, as I said, that in a repetitive movement in the OCDs, especially the repetitive movement, the tics that you get. The
Interesting.
clear of mind, because like
Mhm.
the bigger guys will say, I have a brain fog. That's most probably hydrogen sulfide, or maybe sometimes a headache, because the hydrogen sulfide is kind of vasodilators that will dilate the the veins there. With the kids, you will get a clear mind as well. So you get more focus and more time, quality time, you know, and less stakes and less OCDs.
Mhm.
Um, when you work with the butyric acid axis or the lower butyric acid, you definitely see that the leaky gut is going away.
Mhm.
So a lot of the allergies is just like getting away with working with the butyric acid and boosting the butyric acid directly or through boosting the microbiome. That's a butyric acid producer. So you will see this a lot, that the allergies start to subside or they are not allergy anymore for this kind of food or this kind of stuff that they are using, which is very huge if you're working with this allergy yeah, kind of clients. It's kind of, yeah, you can't even use anything or to modulate the gut because they would be allergic to it.
Mhm.
But I see as well, um, when I look for the whole picture again, I see as well that the brain inflammation is going down, especially when correcting for the butyric acid axis. And we know that butyric acid is a kind of anti-inflammatory with the I10 upregulation and as well working on the epigenetics. If it can pass through the bloodstream and get to the brain, it will work as HDAC inhibitor or the acetylase inhibitors there,
Mhm.
working very, very beautifully actually to modulate the microglia cell or the microglossus there. So I would expect a lot and cross-sectional improvement on all the symptoms, but much more related maybe to the behavior thing. Running around, rocking, flapping, hand flapping, stimming, tics, as we said. This kind of the very beginning symptoms that you get under control when you modulate the gut microbiome. And of course, you can see more speed, more eye contact, all the things that you are missing actually. You will find it. And as I said, I tend to think this as we uh, controlling the inflammation as well as the neurotransmitters, of course, and the signals that we were talking about too.
Mhm.
That's tending to the if you have a high quinolinic acid, for example, coming from the bacteria that, or furacrysol, for example, if you have a Clostridia that's producing furacrysol, then you know that you will have a lot of OCDs because the dopamine is stuck there and it's not converting to norepinephrine. But if you modulate this, then you have the furacrysol effect away, and then your dopamine is kind of converted to norepinephrine, and now you have a lot of focus, more focus, and less repetitive movement and OCDs. That's to draw an example about a psychoactive effect for the microbiome modulation as well.
Mhm. What kind of timeline do you see? How long is it taking for people to notice changes in symptoms?
Um, as as I'm putting it in front, so of course everyone has his own like protocols and way of thinking. So I tend to make a honeymoon first. Okay, that's the first kind of phase or layer that I'm layering. So get them motivated. So I will focus on boosting if and particularly the butyric acid there, and then at the second layer or second phase, everything would be kind of hit because I'm playing now very hardcore
Mhm.
on the out of balance. Then this phase is kind of everything is going crazy,
Yeah.
and yeah, they maybe a die off in France, says if you say, a very hard phase. That will maybe stretch for 1 to 2 months. And I'm hoping to push like have a very strong momentum to push the microbiome to another state, and then this is kind of the transition state that everything is all over the place, and then you subside to the new and then you place in a third phase. And then we run another. This is kind of 8 to 12 weeks, and we run another round, and we see we achieved.
Mhm.
That's life. So sometimes we got something that we wanted, but yeah, almost we get as well something that will go away from
Yeah.
than we think, or like out of control, and then yeah, we have to manipulate this again. Um, 2 rounds for me is actually kind of achieving more than 75-80% of what I'm aiming for. And after that, maybe we do a third round, or it's kind of, okay, now we are in a good place. Now you just do everything that you read about that's going to boost your microbiome good. Because I think your microbiome is now kind of balanced. You don't
Mhm.
have to be that specific targeting this or that. Just try different probiotics that you will find in the literature, not junk probiotics that you will find in a grocery store, but kind of the probiotics that you will find in the literature that they found they were helping with maybe mood helping or anxiety. Just try that. Don't think about that your gut microbiome is kind of very sensitive to this little thing. We now in this state that we hope that the new place the microbiome is in is kind of balanced now, and you have to do something very big to change it to another
Mhm.
state.
That makes sense. That's pretty standard for modulating the microbiome for any condition. You kind of, yeah, you get them motivated, and then when you're kind of doing some supportive work, and then when you're treating the overgrowths, things might get a little bit bumpy
Yeah.
and before they get better. So yeah, that seems pretty standard timeline there for working with the microbiome. Um, all right. So is there any other thoughts, anything else that you want to share with us?
Well, maybe um, something that I was researching, kind of a little bit technical, and there. I did my master actually in the 16S microbiome. So we were focused first on in ESD, and because of some issues, we switched a little bit onto becoming more and more technical. Uh, so we take in the 16S and the capabilities of 16S and the V4 exactly there. So maybe something uh, um, that's not very well known, but we may have some hints about, which is that the species annotation or taxonomies is not that reliable as we actually think.
Mhm.
And this is particularly for if you target for one variable regions, but also if you target two variable regions, you still. If you want to make sure that you, uh, with high confidence, can annotate or for a species, then you have to do the whole, uh, l- not whole genome sequence, but you can do the whole S RNA, not just the variable regions. Then you can annotate this species there. But if you do a V4, then you tend to look for the genus because it's very reliable on the genus level. And that's actually why we don't see fluctuation between different labs when we see the same sample
Mhm.
analyzed with different labs, 2 or 3 labs there. And then you try to look for them. And you will find different in the species kind of level. But when you compare for the genus level, you find them overlapping. That means that one have to focus more or way more when analyzing a 16S sample on a genus level. And actually, most of the research will stop on the genus level. Any research if they use the Selva database, for example, or taxonomy, then that's for the genus level. A lot of like the packages that will annotate taxonomies will stop at the genus level if they work for the 16S. But to go for the species, take it with some of a grain of salt and work on it. I work on a species there, but I'm not freaking out with kind of 0.5% or 1% there. If it's not in the genus level and I'm 100% sure, then I'm not going to freak out. Yeah, this is outside of the range, right? If it's on a species level. And this, of course, it's been like corrected when you run series of samples, because if you have exactly the same settings and you have the same lab and you are repeating your results after the interventions, then you kind of expecting that even if you annotate it wrong, then it will stay the same for the whole. Then you are in a good path there to see. So this is maybe some kind of technical thing. If you look for how technicalities actually the 16S is like the different pipelines, and of course there is too many pipelines, too different pipelines, too many databases. But I found the genus level kind of redundant somehow, or stable, if you would say, to work with the 16S, which is kind of very okay, very good to work with. Nothing to say no, that's bad or kind of not working with. Of course, the shotgun would be like the solution for this, and would be like the ultimate solution if you wanted to really know what's actually the species and even the subspecies. But the very big problem with the shotgun method is the databases. It's kind of an infinite databases there. You have a lot of data, but you can't annotate because you don't have the taxonomy for this kind of. So it's kind of junk that you have. So and if you correlate to the research, then there is very, very little research that doing the shotgun, and you can really find the resources how to modulate the gut if you have this higher resolution as well. So very hard to correlate to the research. I don't like that, but that's what we have.
Yeah, that's where we
right
are
now.
Yeah.
That's what we have. I hope that actually now, when the price is very reasonable with the shotgun, with the shallow shotgun method as well, this would be very good to move when it's feasible.
Yeah, I think those are really great points. And I always tell people, like, okay, don't put too much stock in what the 16S is saying about the species, and just focus on the genus. And a lot of doctors, I kind of get a little bit of pushback, most likely because they're used to working with probiotics, which are very species specific or even strain specific. And so they want to know that level of data. But I'm like, the genus it's great data. Like, it works. Like, we can still modulate that based on just the genus alone, and your patient will get results. So, like, it's fine for now. Like, maybe in the future, as they expand those databases for the shotgun sequencing, for the species, for the subspecies and all that, we'll be able to, expand the research there. But what I'm noticing a lot in the research is when they're using the metagenomic sequencing, they're mostly targeting specific genes, and that's what they're reporting. They're not necessarily using it for taxonomy at this point. So that's a really good summary of kind of where we are and possibilities for the future. So that was great.
Thank you for listening to the Biomesight podcast. Please go to biomesight.com to learn more about microbiome testing for patients and practitioners. Please see the show notes for additional resources and information about our guest.